Okay, Ganeshji, we'll start now. Good morning, everyone. I am Anchal Makhija, and on behalf of MOHAN Foundation and its patient support group Triumph, I welcome you all to this webinar, Prevention and Management of Diabetes Post-Transplant. It gives me immense and great pleasure to invite and introduce to our expert for the day, Ms. Pooja Lakhani, a certified nutritionist, founder and consultant dietitian, Quotient Mantra Private Limited. We welcome you, Pooja ma'am. So according to this research, post-transplant diabetes mellitus affects around 10 to 40% of patients undergoing solid organ transplantation. This is due to the anti-rejection medications that lead to diabetes. So today, through this webinar, let us understand the ways to prevent and manage the diabetes post-transplant for recipients as well as for the donors. So now I hand over the forum to Ms. Pooja ma'am to begin. So she will begin with sharing some valuable information on this topic, and thereafter the forum will be open for question and answer. And also we will have a quick experience thereafter about experience of the recipient, how he managed his diabetes. So we encourage you all to list your queries and ask for the expert about your doubts or questions. Those who is joining us live on Facebook and YouTube, welcome you all. You all can post your queries on the chat box. These patient education webinars are brought to you by our patient support group Triumph, that stands for Transplant Recipients of India and Organ Failure Patients, a movement to provide hope. Know more about us at triumph.org.in and join us. So today we also thank SBI Card and SBI Foundation for their support. Over to you, Pooja ma'am.
Thank you, Anchal. First of all, I would like to say that it's a privilege and it's a delight to see that we're moving towards an overall social situation where we are trying to deal diseases from a prevention perspective. We always talk about chronic diseases which are manageable with lifestyle management. So that's really delightful. But what we are trying to understand today is, see, transplant for any patient is like a milestone achieved. You wait for it for too long. There's a whole journey of struggles, of sufferings, and when you feel it's almost coming to an end, it's really a emotional sort of, I would say, trauma that you get to know there's a complication after transplant. Let's see how we can manage this really common complication post-transplant. Good morning, everyone. I'm Pooja Lakhani. I'm a registered dietitian and founder of Quotient Mantra Private Limited. And today we'll be talking about management of new onset diabetes after transplant. Is my slide visible?
Not yet, ma'am.
Okay.
It is visible now.
Is the slide visible? Okay. So when we talk of diabetes mellitus, it is one of the most common chronic disease which we keep hearing and talking about these days. India has unfortunately become the diabetes capital of the world. But then, what we are going to talk about today is new onset diabetes after transplant. So diabetes basically is an impairment in which there is a failure or an abnormality to maintain and regulate and use blood glucose that is available from our food. And, usually the hormones like insulin and glucagon are there present naturally to manage it. But when there is either insufficiency or lack of insulin or an imbalance between these hormones, in this case, there are, other external factors like your medications, the side effect of immune suppressants, which often are cause of these new onset diabetes, but there could be other causes also. Now, the simplest way to know that you may have developed diabetes after transplant is by simply taking a blood sugar test. And how that happens is when you check your fasting blood sugar, if it comes for more than 126 milligrams per deciliter in 2 consecutive readings. So on day one, if you've tested your blood sugar, fasting blood sugar, and it comes more than 126, it may be, may not be that reliable. You need to take consecutive readings, couple of days or maybe 3 or 4 days as advised by your doctor. And then we'll be able to decide whether you have new onset diabetes after transplant or not. It's also commonly called as no DAT. Now, why is it that a transplant recipient is at risk of developing diabetes? One reason, as I said, is medication. After a transplant, one has to continue taking anti-rejection, or what we commonly call as immune suppressant medicines, so that whatever natural immunity you have should not, sort of try to harm the graft that has been implanted. So naturally, whatever foreign body enters our human body, there is a mechanism to fight against it. Okay, we do not want that because it's an external organ that is transplanted into your body. The body will consider it as something foreign and start attacking it. We need to stop that, we need to prevent that, and hence transplant recipients are almost for lifelong on immune suppressant medications. Now, while these medications are essential and there are many benefits in sustaining quality of life, graft function, and a lot many other factors, the side effects are also there sometimes, and the most common one is diabetes. It definitely puts you at risk of developing diabetes when you're taking immune suppressant medications. There are other common reasons also. For example, if you had a genetic history, for example, your parents or siblings have diabetes, or if you are overweight, or if you have lack of physical activity, these are also factors that can cause diabetes. But one of the most potential risk factor is, of course, being on immune suppressant medications, as I just said. So apart from medications, what are the other reasons that can increase your risk for developing a diabetes? Now, we cannot say that if you're overweight, if your parents have diabetes, you will definitely develop diabetes someday. It's not like that. It increases your risk. Okay, so there is a difference between a definitive, having a definitive disease and having an increased risk. Okay, other reasons, as I said, which increase your risk of developing diabetes after transplant include being overweight. Now, here there is a slight higher risk when you talk of Asian population. I would say particularly Indians, that for us, the BMI ranges are different. So commonly in the UK, US, and other Western countries, you're considered to be overweight if your BMI is more than 25. But if you're Asian, if you're Indian, for that matter, the audience that I'm addressing now, in for our case, if our BMI is more than 23.5, we are considered as overweight. Why this difference? That is because genetically or naturally, our body's composition is such that we tend to have more fat in our body composition. So there is naturally more fat. We are naturally genetically at higher risk of developing these chronic diseases. Okay, so if you're South Asian, if you're Indian, if your BMI is more than 23.5, that increases your risk of developing diabetes after transplant. Then, of course, lack of exercise. If you're not into having a regular physical activity, that may increase your risk. Unhealthy eating. Now, again, this I would say a lot of times, is perceived as an unnecessary restriction because, people who are suffering with an organ failure, whether you have kidney failure, whether it is liver failure, or you've got heart failure, any vital organ failure is a very difficult condition, clinical condition to deal with. You're taking a lot of medications, there are adjuvant therapies, there are a lot of dietary restrictions. Post-transplant, naturally one would want to start eating their favorite foods. You would want to, again, go back to your indulgences, go back to your likings. But then if you are tending to change your diet very rapidly from healthier eating to not so healthy eating, that also increases your risk of developing diabetes. Again, if you're an Afro-American, if you're American Indian, Alaskan Native, so genetic makeup is something which we cannot change. Being of age 45 or older is something we cannot change. Family history of diabetes is again a non-modifiable factor. Having had diabetes during pregnancy, if you have high blood pressure or abnormal lipid profile, or if you've had a history of hepatitis C virus infection. Now, the last few points that I've mentioned are unfortunately non-modifiable. If you have these risk factors, there is nothing or probably very little that you can do about it. But managing your weight, managing daily physical activity, and managing a balanced eating habit is something which is pretty much under your control. It's definitely a modifiable factor. And if you put up a fair amount of control upon these three factors, then all rest of the 5 to 6 factors can probably, not make an effect that is potential enough in causing diabetes. Okay, of course you can still have it, but if you have the other three in control, there is a lesser risk. Now, what are the warning signs? How is it that you know? So when initially post-transplant, you're in hospital, or after discharge also, you're pretty frequently visiting your physicians. They may check your blood sugars pretty regularly. They'll keep a watch on how your fasting blood glucose levels are and other blood parameters are, so you can easily identify. But for example, if you've had your transplants, your transplant is say probably been 6 months or 1 year back, then you may have less frequent visits. Now, the best way to find diabetes is definitely to test it regularly, but when you're visiting your doctors less frequently, it's also called a silent disease, and the symptoms are so subtle that you may not really find it unusual. So for example, if you're feeling unusually thirsty, okay, often you feel you have dry mouth, you're drinking lots of water, and still you keep feeling thirsty. If you're urinating quite often, especially in the night, you have to wake up multiple times to pass urine. Or if you're feeling very hungry very often and you get tired easily. So for example, earlier you were okay performing all your home-based tasks and also maybe working from home, you were able to maintain your energy levels. But then, off late, it will slowly happen that over a few weeks or months, your ability to perform physical activity starts reducing gradually. Now, the trick here is most of us do not give a lot of attention to it. Okay, so for example, earlier, if it was easy for you to climb stairs, say maybe 5 to 8 times a day, couple of floors, and now if you get tired, we don't really give it a lot of importance. These are small signs which you should be keeping a check upon. If you're feeling thirsty often, if you feel hungry too often, if you're getting tired easily, please speak to your physician and make sure you're keeping up with all the routine blood tests that have been advised to you. Okay, losing weight, involuntary weight loss when you're not trying. Now, if you've had a kidney or liver transplant, a lot of times this loss of weight is perceived as loss of the fluid retention that was there. So a lot of times we feel, okay, पहले fluid retention होता था body में, अभी because I have a well-functioning kidney and a well-functioning liver, maybe that water is, I'm getting rid of that water and इसलिए weight loss हो रहा है. Speak to your physician. If you're losing weight, if you're eating, pretty regularly, in fact, if your appetite is more, you're eating slightly more, and still you're losing weight, you may want to check your blood sugar levels and perform a couple of other tests. Do keep a check on these signs. If you've got small wounds that are taking very long time to heal, if you have dry itching skin, if you're, sort of feel numb in your extremities, so fingers, your palm, your toes, and your feet, if you feel numbness quite often, a tingling sensation quite often, you should talk to your physician. Or if you have a blurry eyesight, and these are very subtle signs that you were able to read from a distance earlier, but now it's become slightly blurred. So these are signs that, especially post transplant, you should be keeping a checkup on. And if you feel any of this is happening to you, talk to your physician. What can you do now? We'll quickly go to what is it that can be done to prevent or keep under control this complication that often develops after transplant. Definitely, you've got to maintain a regular physical activity. Now, a lot of times we feel, okay, now I'm 8 months, 1 year, 2 year post transplant. It's okay. My graft function is well. My immune suppressants are low. It's not very essential to maintain all the restrictions. Physical activity and balanced diet should not be perceived as something that is a part of your transplant treatment. It's a lifestyle. It's a necessity that needs to be maintained probably for lifelong. Like you brush your teeth every day, like you take bath every day, there are basic activities that you have to perform every day, irrespective. Having a physical activity, eating a balanced diet should be made a part of your routine in these ways. Okay, so like you don't think that I brushed yesterday, taken bath yesterday, it may not be required for next 2-3 days. No, the same way, physical activity and your regular balanced eating is required every day. If you're overweight, if your BMI is more than 23.5, probably you need to lose some amount of weight. Again, talk to a qualified dietitian and make sure that what you're losing is fat mass and not your muscle mass or excess water from the body. Maintain this healthy lifestyle. Keep a routine check on your blood sugar, blood pressure, and make sure they're under control. And keep regularly testing for diabetes. Maybe, if you've been having fairly normal values, checking once in 6 months or annually, or maybe as directed by your physician, is something that you should be doing. Now let's go to, but then we've talked about all probably, things that are very commonly explained by the physicians, dietitians, and other team members. But what a patient goes through is has a lot of emotional quotient also. Okay, so medicines lena, acha khana, rose physical activity karna, saying all this is very easy. But the one who's following has a lot on its head. So a patient's whole journey is actually an emotional roller coaster. You've, of course, got to modify your food habits. There may be restrictive diets that you're already following, and you post-transplant expect these restrictions to come down. Maybe, you feel hungry more often because with chronic diseases, your appetite goes down. And once your graft is functioning well, your normal appetite may come back. So you may feel hungry more than, you used to, the appetite that you used to have before transplant. There may be, comfort eating that you're always told to stay away from. So there are foods that you really like, but then, post transplant, you're told to eat fresh, bahar ka nahi khana hai, fatty nahi khana hai, sugary nahi khana hai. So comfort eating is a lot of times kept away even after transplant. And if you happen to indulge into it, if there are things that you have eaten, a lot of times there could be guilt. You may be worried if it will affect your newly transplanted organ. And ultimately, it leads to a negative relationship with food. If you're overweight, trying to lose weight, if you're trying to keep up with your immune suppressant medications, trying to, make sure that you don't get diabetes, all this may eventually create a fear, sense of guilt towards food. So there are foods that you really like, but you're afraid or scared to take it. Okay, and if you happen to take a couple of servings, you feel guilty, and eventually you're scared of taking it. It's a lot of emotion involved there. You feel angry. You may feel angry. There could be rebel against the diet advice. You feel low. Your confidence levels are affected, and there is this emotional and physical deprivation which may happen. So while we expect that post transplant people feel happy, they feel satisfied, their quality of life should improve. Emotionally and psychologically, there is a lot that is still trying to be that a patient is still trying to settle down with. What can we do? How can we really improve this? So first of all, we try to take away all the no's. Okay, no this, no that, you don't have to eat this, keep a restriction on this you cannot eat. Let's try to keep away all the no's. Let's try to see what are the yeses. How long is the list of yeses? What all are the foods that you're allowed, so that you have more yes to eating and yet less no. What I'm going to emphasize over here is a balanced form of eating, where you've got quite a bit to explore, eat, and enjoy. We're going to emphasize on this one after the other, talking about each and every food group which is commonly a part of your diet. Let's first begin with cereals. Now, cereals provide the maximum amount of the majority of energy that is required from your diet. Okay, so minimum 6 to 8 servings should be taken per day. Now, what is one serving? First of all, what do I mean by cereals? So your anaj, your dal, chawal, roti, your chawal, roti, your breads, your biscuits, noodles, cookies, pastas, your potatoes, all these are included in cereals. These are predominantly energy providing foods. You should be taking minimum 6 to 8 servings a day. Now, when I say 6 to 8 servings, what does that mean? So one palm size roti is one serving. Okay, or a katori of rice is one serving. These two are exchangeable. Each one will provide 100 kilocalories. If you take a slice of bread, that is around 80 kilocalories and gives you close to one serving. And if you're taking one medium-sized potato, that gives you again close to 60 to 80 calories, depending on the variety of potato that you're taking. And again, it's close to one serving. So such 6 to 8 servings you should be taking per day of cereals. Now, a lot of times what you're told is, maida nahi khana hai, noodle nahi khana hai, pasta nahi khana hai, you should not be eating breads. And there's a long list of no. Which is true. You should be avoiding refined flour products. You should be avoiding processed foods as much as possible. But then there is a lot of yeses also which are there in this list. You can, of course, eat whole grains, which include ragi, jowar, bajra, quinoa, foxtail. There are many millets also these days available. You can, include, you can probably include it in the form of a mixture where you're combining these grains and preparing your pancakes and rotis. If you like to, for a change, make some pancakes, you can make it with oats. If you like to take, noodles and all, these days there are noodles and pastas available which are made out of millets. For example, there is a ragi ka noodle, there is an oat ka noodle available. You can take that. And again, if you're able to keep a moderation, if you eat it once in a while, and that while is at least 15 days apart, then it's all right. Okay. So while we say no processed foods, no maida, no and all that, let's talk more about moderation. If you really like these foods, you can take it probably twice a month. So there are 4 weeks. Second and fourth Sunday, you can enjoy these. Take it in a restricted quantity, prepare it with a lot of vegetables so that the balance can be maintained. Choose more of whole grains. Like I said, you can choose whole wheat, jowar, ragi, bajra, oats, quinoa. You can include it in your diet on daily basis. Now, these whole grains are not only, energy providing foods. They form the potential and a rich source of fiber in your diet. They are quite rich in B complex vitamins, iron, calcium, particularly for vegetarians. If you don't take organ meats and all, your whole wheat and these grains can give you a good percentage of iron in your diet. Okay, so while we look at adding variety to the diet, the added benefit is there's a lot of fiber and micronutrient packed in here. As I said, you should be avoiding refined flours. But if you really like taking bread, for example, all of us love sandwiches, it's okay to take 2 slices once in 2 weeks or so, and enjoy your favorite sandwich. Okay, it's not a complete no-no, provided you're able to, mentally, emotionally train yourself to maintain that moderation, to maintain the less frequent intake. For non-diabetics, 3 to 14 spoons of sugar per day is fine. But if you've had a history of diabetes in your parents, if you're slightly overweight, and probably if you're not able to maintain so much physical activity, then maybe as a preventive measure, you should try and avoid on these simple sugars. When you're buying breakfast cereals and packaged foods, you should also be looking for the added sugar which is there. So nowadays, there is a whole variety of cornflakes, mixed cereals, and mueslis and breakfast cereals which are available. These are healthier options, definitely good source of fiber. Nowadays, these are available with added nuts and all of that. But when you're purchasing, you should see that what is the amount of added sugar. If it has added sugar per serving, if it is more than 1 or 2 spoons, then probably you should choose varieties which are low on added sugar or do not have added sugar. And if you're liking, probably trying to maintain a balance, then you can mix the two. Buy a cereal which has some added sugar and a breakfast cereal without added sugar, mix the two and you can take. Okay, so that brings down the overall sugar content. Next is fruits and vegetables. Now, post-transplant, a lot of times you all are told ki sabzi, phal, kacha nahi khana hai. And for a very long time, you're having a diet which is devoid of fresh fruits and vegetables. Why are you advised on, restricting your fresh fruits and vegetables intake? Is because you want to avoid any infection. Okay, so now it's not that you should be having a diet which is devoid of fruits and vegetables. The handling is important so that you don't catch any infection. Okay, so washing your fruits thoroughly, washing your vegetables thoroughly, removing the skin. You can consume fruits and vegetables. In fact, minimum 5 servings per day in the raw as well as cooked form should be included. As soon as you buy fruits and vegetables from market, wash it nicely and store it in the refrigerator. Don't leave it in the open. When you're consuming your fruits and vegetables, remove the skin, cut or chop your fruits and vegetables and consume it immediately. You should be avoiding on cut fruits and vegetables that have been prepared and kept for a long time. Eating fresh fruits and vegetables which have been prepared, say within half an hour, can be easily consumed. Aim for at least 3 different colors of fruits and vegetables. Now, why we say this is it again improves your overall micronutrient intake. So deep yellow to orange fruits and vegetables, then the ones from the green family and the purple fruits and vegetables. If you're able to consume one each every day, then it again takes care of your micronutrient as well as your fiber intake. No fruit or vegetable has any magic or miracle. So for example, if you believe कि kidney transplant के बाद eating X fruit is better, liver transplant के बाद eating Y fruit is better and it will help your liver, that may not be true. Whatever is seasonally and locally available, you can include 1 or 2 servings of those fruits every day. Okay, and overall you should be taking minimum 5 servings. Avoid canned fruits and vegetables because these are very high in sugar and salt. So bahut baar, how we perceive it as, okay, I cannot eat fresh fruits, maybe I can take the canned ones. Okay, that has been cooked, that has been packed very nicely, it's hygienic. Definitely from the hygiene part, it's very safe. But it has, in the process of its preservation, it has a lot of sugar and salt added. Now, even if you're consuming a product or buying a product which has been sort of prepared in its own stock. So these days there are a lot of vegetables and fruits available which they say has been prepared or sort of preserved in the vegetable or fruit stock only. Even then it is high in the natural fruit sugar. So you should try and consume more of fresh ones and avoid the canned ones. If your potassium levels are high, say maybe more than 5, still you can consume fresh fruits and vegetables. You probably need to avoid the green leafy ones. If you're consuming green leafy vegetables, you can cook it thoroughly, drain the water, a process that is called as leaching. You can consume that. And for fruits, you can choose apple, papaya, pineapple, pear, guava. These are relatively low in potassium content. You can take 1 serving per day. Fruit juices you should be avoiding, particularly if you have risk factors that can lead to diabetes, because as I said, even if you're not adding any sugar to your juices, when you consume orange, you will probably eat only 1 orange. But when you're taking orange juice, you will probably squeeze it from 3 to 4 oranges. So in a glass, you're taking natural fruit sugar, that is fructose, from 4 oranges, and there is no fiber. So try to avoid fruit juices as much as possible. But if you really are fond of these, then maybe twice or maximum thrice a week, a small glass that is 150 ml is something that can be taken. Next, let's come to protein. Now, when you have a chronic disease, a vital organ failure, that condition, the clinical condition goes on for a very long time. Okay, and there is a significant amount of muscle mass loss that happens. When you have lower muscle mass, that also affects your insulin sensitivity. Or if you have higher fat percentage, that affects your insulin sensitivity. Again, a risk factor for diabetes. You need to maintain 1.2, minimum 1.2 gram of protein intake per kg body weight, so that you're able to again prevent your risk for developing diabetes. Okay, now include protein sources like maybe, pulses, milk and milk products, eggs, chicken, fish. You should try and avoid red meat. As I said, especially if you have edema, you should try to take 1.2 to 1.5 gram protein per kg dry body weight. Maintain it for at least 3 months post-transplant, so that we are able to preserve whatever muscle mass you have at the time of transplant, and B, we are, during this whole process of recovery, you don't lose your muscle mass further. Okay. Now, minimum 3 servings of high biological value protein sources should be included. High biological value protein sources are milk and milk products, your doodh, dahi, paneer, all these are included. Then comes your egg, which is 100% biologically available. What does biologically available mean? These protein sources, when you consume, more than 90% is available and absorbed in your body. Okay, so that is technically called as biological value. Now, eggs have 100%. Egg is in fact a reference protein. When you consume egg, so for example, 1 egg white has 3.5 gram protein. That entire 3.5 gram is available to your body. Compared to milk, which is milk and milk products, which is 95% available. Then comes your chicken, fish, which is also more or less in the same range. Then your lentils, dals and all are somewhere between 80 to 85%, and they still form a rich source of protein. Now, if you're a vegetarian, you should also include soy and soy products, because again, biological value of soy and soy products is higher than your dals and legumes. So in the decreasing order for vegetarians, the highest biological value is milk and milk products. Then comes soy, and then comes your dals and beans. Choose nuts and oilseeds. Again, these are packed sources of essential fatty acids and your high protein as well. 1 fistful of mixed nuts you can take every day. This again takes care of essential fatty acids, your fiber intake, your protein, and your fat soluble vitamins also. Minimum 3 servings of skim milk and milk products you should be consuming. Make sure you're taking milk and milk products in a range of 400 ml to 500 ml per day. So a small cup of milk in the morning and at bedtime, and a katori of curd with 1 or 2 of your meals easily gives you 400 to 500 ml of that intake. This gives you high biological protein, the required calcium, and also if you're consuming curd and all, that helps maintain your good bacteria. And we talked about soy and soy products also. If you're a vegetarian, make sure you're including this in your diet at least 1 to 2 times per week. Now, let's lastly also talk about fats and oils. These are for long have been considered forbidden, and we try to keep a low fat diet, keep restricting our fat intake, which is good in a way. But we should also remember that fats also play a very crucial role in maintaining our overall metabolism and our body function. And there are good forms of fat which can eventually prevent diabetes. So you can definitely include a sufficient amount of fats and oils in the diet, provided you're choosing the right sources. Also, these are again form a calorie dense food, and about 30% of your total caloric intake can come in your diet can be taken from healthy sources of fats. You can include vegetable oils, sunflower, safflower, rice bran, soybean, even olive oil, groundnut oil, all these oils can be included. The quantity that you can take every day is 20 to 25 ml if you have normal BMI. And if you're slightly overweight, maybe 15 to 20 ml is the range. As a thumb rule, it should be 500 ml per month per person. So if you have a family of, say, for example, 4 people, 2 liters per month should be your target. Okay, and this amount is good enough to restrict your fat intake, at the same time provide enough calories and essential fatty acids that are required. Over here, the ones who were, a few who were interested in using olive oil and for its antioxidant benefits and all, keep in mind that olive oil should not be cooked for too long. If you're buying virgin variety of olive oil, then probably it's meant for your salad dressings or just quick stir frying. If you're buying pomace variety, then this is the one you can probably use for a short cooking, maybe 5 to 10 minutes. If you cook olive oil for too long, it tends to lose its antioxidant properties, for which you would actually bought this. So you're not getting all the benefits out of it. This is the quantity that I just mentioned. Now, the ones to avoid, as a simple thumb rule, you should avoid fats which are solid at room temperature. So out of the refrigerator also, if you keep butter, it'll soften, but it'll remain solid. Your ghee remains solid at room temperature, margarine and all. So while in the Indian community, particularly, it's perceived that ghee is very healthy and it should be consumed on regular basis, you can include ghee in your diet. The quantity needs to be restricted, and maybe the frequency at which you take ghee also needs to be limited. So if you're fond of ghee, if you want to include ghee in your diet, maybe 2 to 3 times per week in a quantity of not more than 5 ml, 10 ml is fairly okay. But the day you're including ghee in your diet, make sure you're balancing your oil intake accordingly. It can't be that thrice a week you're taking that 10 ml extra ghee in addition to the oil that is already there in your diet. That balance needs to be maintained. Avoid deep fried foods. If you're a non-vegetarian, particularly fried chicken and fish is something people really enjoy. You can take it, again, moderation. You can probably take it once in a month if your BMI is normal, if you're regularly into some sort of physical activity. But if not, then maybe you can choose to enjoy your chicken and fish in the grilled, roasted and other more innovative forms of cooking. Cutting down oils completely is not advisable. Even if you're overweight, even if your weight is high, you need to consume some amount of good fat sources, definitely. Again, your nuts and oilseeds are also good sources of fat, and you should be including it in your diet every day in a quantity that is 1 fistful. And if you're consuming oil seeds like flaxseed, pumpkin, chia seeds, 1 spoon every day can be included easy. Balanced diet regime, there are many sort of different diets which are available, and these could be really some fun and innovative ways to deal with diabetes, whether you're doing carbohydrate counting or you're taking some diabetes specific formulas, or you've got an intermittent fasting regime. All these are therapies, or all these are dietary regimes which have scientific evidence in the benefits that they provide. But make sure you're talking to a qualified physician or qualified dietitian, and whatever you're following is under supervision. Now, this happens initially for 6 months, for 1 year. We are very, very particular of what kind of diet we are following, what physical activity is there, about our medications and everything. But as time passes and our transplant journey starts settling down a bit, we tend to liberalize all this. Be regular with your health checks, be regular with your physician follow-ups, be regular with your blood test regime. If you're planning to follow some kind of particular diet that is very much trendy and you've not done it before, talk to your physician and dietitian. Whatever you decide to do, there is no blanket rule of yes or no, but you should always be doing it under supervision. It's better to take sort of precautions than later on trying to treat a complication that you may develop. With this, I'd like to conclude our today's discussion. Thank you for being a lovely audience. We can connect for a happier living with diabetes. We'll be happy to connect with you over Poshan Mantra. Thank you.
Thank you so much, Pooja ma'am. That was beautifully explained. Before we take questions, I would like to invite Mr. Priyadarshan Bhavikar, who is an automobile journalist. He was on dialysis from July 2020 to March 2022. In March 2022, he got his kidney transplant and his mother donated to him. And he have been diabetic since 2010. So today he will be sharing with us his experience on how he managed his diabetes post-transplant. Over to you, Mr. Priyadarshan.
Hi, can you hear me?
Yeah.
Hi, Angel. Thank you so much. Thank you for the lovely introduction, and this whole session was quite informative. So in my case, I was diabetic. I still am overweight. I was very overweight before. So before I got diagnosed with CKD, I was over 106 kilos. I'm 5'9", so you can imagine, quite overweight. So post dialysis, I was 97, which I'm sure my approximate weight even after surgery. I had a little bit more with fluid gain, but then once that came down, 97 was my stable weight. So now I've brought that down to 86. So I've been doing intermittent fasting. So I'm doing a 16-8. 16 hours of fasting, 8 hours of feeding, and mainly lots of activity as well. Because people don't realize that if you just do intermittent fasting and don't do activity with that, it's of no real consequence, and you will end up losing muscle mass. So I make sure that I exercise at least 1 hour a day, like every day. So when it's like if it's outside, if it's raining, then I won't go for a walk. I'll do some indoor cycling. If I can't do that, I'll walk up and down the building. So I live on the 9th floor. So going up and down 3-4 times is more than enough cardio for the day. So I do that. Food-wise, what I've done is, of course, I've cut down on just the amount of food I eat. Like everything is in moderation, as Pooja explained. I do indulge once in a while. So I will have my fried chicken or whatever, once a month, maybe a little bit. But the main thing is moderation. That is the biggest thing to take away for me has been after this is just everything in moderation. And main thing is, so what I do, I don't have breakfast, and that's in a fasting period. So my first meal is lunch. For lunch, usually I have a mixed millet bhakri with a sabzi, and I might have with that yogurt or a couple of eggs or something like that. And then for dinner, usually I have a couple of eggs, a piece of toast, and a bowl of soup. That's pretty much my meal for the whole day. Otherwise, morning, the only thing I have after I wake up is a 1 cup of black coffee, because I can't function without my coffee. So, but no sugar, no sugar substitute, no milk or cream or anything like that. But yeah, I mean, the thing is, so right now my sugar levels are basically almost non-diabetic. Like initially, I was on insulin after surgery, but that didn't seem to help me manage my sugar all that well. And what I did a lot of reading online and watched a lot of videos, especially of this doctor called Dr. Jason Fung. So he's a nephrologist who really advocates fasting. And then I spoke to my physician as well, and then we kind of got on this plan. I'll start IF, and then once my sugar levels come down a little bit, I'll get off the insulin and get on tablets only. Which is what I'm taking. So I'm taking metformin and I think linagliptin. That's it, and it's not much. Like it's a fairly small dose, and that my fasting sugar is like around 85 to 95 k. My postprandial also at the most goes to like 130, 135, and I've been so my A1C I did recently that came to 5.6 or something, and I'm sure by the next one it will be even lower than that. So yeah. But main thing is to Pooja, you're on mute, so we can't hear you.
Sorry. So I said that you're pretty much in the normal range. 5.6 is good. Don't try to bring it down further.
So I basically main thing again, as you said, it's a lifestyle thing. It's not a thing. Okay, I'm doing this because I've had my transplant. The way I look at it is, I've had my transplant. It's like a second chance of to live my life more fully. So I'm just doing everything I can. And I made it part of my everyday thing. Like if I don't exercise, I feel so horrible. I'm not just guilty, just physically I feel like I've not done something. Like I need to do it. Like just so if I can't do it in the morning, I'll do it in the evening. And I think the important thing is to find something you love, right? I love cycling. Actually, I love motorcycles, so I love cycling as well. Yeah. So as every chance I get to go out cycling, I just go out cycling, and I'll do like 10k, 15k, very very comfortably now. So I think that switch in the brain happened from my lifestyle was fairly sedentary. Like I used to have, obviously being an automobile journalist, I used to have my days of shoots where I'm out all day in the field and all that. But otherwise, it was just sedentary, sitting at my workstation pretty much the whole day, and yeah, consuming crazy amounts of sugar, Red Bull, lots of Red Bull, which was really bad for me. So. Yeah. Yeah, mainly so having cut down. So even sugar, I don't deprive myself of sugar completely. I'll have occasionally I'll have some chocolate, a piece of chocolate, but again, as I said, in moderation. Everything is in moderation. Yeah. And if I know I've indulged on a day, I'm going to work out extra hard that day. So.
That's good. See, the balance you've been able to strike is really commendable. And it's, as I said, it's not just something that a dietitian will write and give you on paper, something you've read online, or something that your doctor tells you. It is something that you sort of are able to incorporate in your regular regime. It's the change that you are able to bring forth. Now, a few things I'd like to just appraise our listeners with. Intermittent fasting doesn't essentially have to be without breakfast. It is that it is the time period that he is most comfortable. So 16:8 means you, out of 24 hours per day, you fast for 16 hours. These could be 16 hours of your choice. Usually people find it easy to fast overnight and for early morning hours and start eating in the mid-morning hours or at lunchtime as he's doing. So it's not essential. Okay. Again, when you're following intermittent fasting, your micronutrient, multivitamin intake, your fluid intake, there are a lot of things that needs to be monitored, and he's doing it under the supervision of a physician. You should also be having someone guiding you. We recently had a research paper published for ADPKD, post-transplant recipients, that is polycystic kidney disease. In that, what they found is a low-fat diet or a carbohydrate controlled diet, it was equally effective as intermittent fasting. Okay, but people who were following the two, so typically for research, they will divide their subjects into two groups. One group will follow one diet regime, the other group will follow the other diet, and then they compare. Okay, what they saw was low fat carbohydrate controlled diet and intermittent fasting were more or less similar in terms of benefits like reducing weight, like preventing diabetes or managing diabetes. But intermittent fasting was, people reported it as something that was difficult to follow. So while Mr. Bavekar is able to follow it and he's doing wonderful, he's brought up an example that we all look up to. If you're not able to follow it, it's not the end of the world. Okay, you can very well opt for a diet regime that is balanced and that suits you. Okay. So I just
it's about finding what works for you.
Yes,
like I tried the low carb thing as well, but I found it a lot easier to just say, okay, I'm going to not eat for 16 hours.
Correct.
Then try to manage how much I'm eating every time. That was a little more difficult for me. It's more easier,
so
actually.
Yeah. So while he fasting and not eating for a few hours is easy for him, that may be really difficult for you. So always remember that dietary manipulations, the options could be many. The end road is to achieve your nutritional requirements. So if you're able to control your carb intake, your sugar intake, your energy level overall is under control, you're eating enough protein, good fiber, then that is what we are trying to achieve. Abhi aap usko intermittent fasting karke achieve kar pa rahe, or you're reducing your quantities, eating more frequently. That depends on how it suits you. Okay, so there is no one size fits all. There is no blanket rule that applies. The ultimate goal here is to achieve a balance that you're not only able to establish but sustain also. Okay, so एक बार weight loss हो गया, उसके बाद क्या? आप उसको 6 महीने के बाद 1 year, 2 year, 10 years तक कर पा रहे हैं या नहीं? That is what is more important.
Absolutely.
Thank
so
you.
Sorry. And I was just saying, I think on a personal level, I think I've found the balance that really works well for me for now, because right now I'm still working from home. The moment I start going out on shoots for my job, then things will again have to get
change
and rearranged. Yeah, because when you're out shooting, we go in the morning at 5, we come back evening at 7:38. So then how do I manage my meals and all that? So something I have to really figure out.
Yes,
and
definitely.
Right now I can still skip the morning breakfast because I'm not doing much activity in the morning per se. It's just my normal morning stuff. But if I'm out working hard in the sun, say, I will definitely feel hungry earlier.
And fasting may be difficult. True.
Yeah, so then I had to figure out what to do at that point. Right now it's working and it's working very well, but it will require tweaking throughout my life basically.
Yeah, so it's really amazing. You can you sort of inspire a lot of people who are listening to us today. Thank you for joining us.
Thank you for having me.
Thank you, Bhavika sir. It was really inspiring and motivating for all of us, for the the regime you are following, also the fitness activities you are doing. So thank you so much. So we'll move to our question answer session. If you have any questions, you can unmute and ask. Pooja ma'am, what about the consumption of sugar, like using of stevia or brown sugar? Is it recommended?
So see, the golden advice here would be to try and get rid of or manage your sugar cravings. Okay, now it is not as easy as I am able, it's not easy said, done then said. So while sugar free and sweeteners and alternatives form a very handy option. Okay, they are calorie free. You add it in a very little quantity. Nowadays, they are easily available. But what happens is prolonged use of these sweeteners also has been associated with increased cancer risk. Okay. So what you got to do is, if you are consuming sweeteners, again, slowly, gradually try to get rid of it. It's not that one morning you'll wake up and you'll say no to sweetener today and you'll be able to sustain it. Everything happens gradually. Bring down your sweetener intakes down slowly. About sugar alternatives like brown sugar, jaggery, honey, I would say all these are more or less equal in the amount of calories that you will get. Okay. So sugar versus honey versus jaggery are more or less equal in the amount of calories that they'll provide you. The only benefit with honey and jaggery is they contain some micronutrients. So honey is rich, jaggery is rich in iron, honey is rich in some B complex vitamins. But then, if you read the label, when you're next time purchasing honey, if you read the label, these are per 100 gram values. And the amount of honey you consume every day, or maybe whatever you're taking in one serving, is probably 1 spoon, close to 8 to 10 grams. So, for example, 100 gram में आप देख रहे हो कि 20 gram B complex है, 20 milligrams. Okay, but that what you consume is only 10 gram honey. And what you get is only 2 milligram B complex, which will not be of any benefit in your body. Okay, so sugar versus honey versus jaggery, there's no healthier option. You reduce the quantity, you do try not to exceed more than 2 to 3 teaspoons a day. If you're not diabetic, if you're not overweight, then this is the limit. If you're overweight, if you're diabetic, then maybe even less. Okay, so practicing control and having a moderation is the golden advice here.
Absolutely. The formula of not saying no, but everything in moderation and
everything in moderation. Yeah.
Any other question? Anyone want to ask something related to diabetes or other query?
Hello, ma'am. I just have a question.
Yes, please go ahead.
What should be the dinner time, ma'am? So till what time like we can eat?
See, there are two things here. One is every day you should be having a minimum 7 hours of sleep. Okay, ideally this should be between somewhere 11 to 7. That's how your biological clock works. And you try to eat at least 2 hours before bedtime. Okay, so 2 hours before bedtime is the limit when you try to consume your dinner, and minimum 7 hours sleep. These two things you need to probably adjust and fit into your daily schedule.
Okay, thank you, ma'am.
Yeah.
Okay, Pooja ma'am, one more question I have. Like, we believe that insulin is more, safer than medicines, as medicine will long-term cause damages to organs. So, but people have a lot of fear for using insulin, even if the sugar is, not controlled at some certain level, doctors recommend them insulin, but somehow people want to ignore or avoid. Do you want to, tell something about it? Medicines versus insulin.
So you're consuming apples and oranges. There's no comparison between the two. Whether you require medicine and oral anti-diabetic or you require insulin is 100% dependent on how bad your diabetes is. And you should 100% follow your endocrinologist or physician's advice. Do not try to manipulate your medicine and insulin doses upon what you feel. Okay, or 1 day's sugar value. So if you're doing home sugar testing, don't try to manipulate your insulin accordingly unless you've been trained by a doctor to do so. Okay, so follow your doctor. Don't try to self-treat is number one. Number two, what happens is when you've lost, so there are multiple researches which show that as small as 5% of when you lose 5% of your excess body weight can bring down your medicine and insulin requirement. So when you're on a weight loss regime, when you've lost a reasonable amount of weight, a fair amount of weight, keep going back to your physician. Okay, because your insulin requirements and medicine requirements will more or less in hand, it will parallelly it will reduce parallelly. Okay, so you need to be in touch with your physician and dietitian on regular basis. If you've lost 5% of your excess body weight, talk to your physician. Keep a track of your blood sugar levels. It will come down. But never ever in any situation, whether you're losing weight, not losing weight, irrespective of what your blood sugar trends are, never ever try to self-treat. There is no comparison between insulin and medicines. You need to follow whatever your doctor is recommending.
Yes, right. Absolutely right. Anyone else want to ask any question? Okay, then with this, we'll conclude our session. And thank you so much, Pooja ma'am, for once again a very brilliant and informative session. Thank you so much, Mr. Bavekar, for sharing your experience. And thank you so much to SBI Card and SBI Foundation for their support. So thank you so much to our wonderful audience for listening patiently. And once again, thank you, Pooja ma'am.
Thank you for having me. It's always a pleasure to work for this noble cause.
Thank you. Thank you so much. Have a great day, everyone.